Hi everyone, welcome back to the Who Cares podcast. My name is Laura Travers, I'm from the Devon Alliance for International Recruitment, and I'm here today with John.
Hi everyone, I'm also from Who Cares podcast, and we're in a different location today. It's very exciting. We've gone on tour. We're on tour in Torbay.
Yeah.
So, who are we with today?
So we are here with Sarah. Would you like to introduce yourself, Sarah?
Hello, Laura. Hi, John.
Hi.
Thank you so much for coming on
You're
tour and
welcome.
visiting us in Torbay today. I'm Sarah Aston. I'm a public health specialist and I work for Torbay Council.
Great, thank you for having us. Lovely office.
Thank you for coming. Well, rather echoey room.
It's quite
very
epic, but it's very grand, isn't it?
It is very grand.
You were resembling it to a much grander place, but it is very grand.
I like it here, it's quite nice, isn't it? It's different to the office.
It
It's
is
nice
very
to be out.
different, yeah.
So we are here today to talk about National HIV Testing Week.
Very, very important subject.
Really important.
Great. Well, thank you so much for giving me the opportunity to talk about it. It's a big week nationally, and it's something that we're marking in Devon and Torbay and Plymouth and up and down the country. And I've been working around HIV on and off, for about 30 odd years.
Oh, goodness.
I know, I barely look old enough, but it's true.
Which one do I press? Press one.
Oh, I know, press them all.
Fantastic! I didn't know you had those buttons.
No, we've got lots of little buttons. It's all good. It's all
What
good.
does this one do?
I won't do anymore.
So I've been working in and around HIV for a long time and seen a huge amount of changes in that time, mostly for the better as well, in terms of the progress of technology and treatment. But this is one of the times of the year where we talk about HIV, we're allowed to kind of shout about it a little bit. And I was looking at the news this morning when I woke up and I could see that Prime Minister Keir Starmer is the first G7 leader and Prime Minister of this country to take a public HIV test.
Amazing.
I know. Hats off to
Yeah,
him.
well done, Keir.
I have to say, whatever stripe or your political persuasion, I admire a leader who's prepared to put themselves out like that.
Definitely.
So,
And I think it affects so many people, doesn't it? So many people will live with this every day. To see him stand up and say, "Well, do you know what? Let's do it in front of everybody," is a real sort of force to be reckoned with, isn't it? For those people who are feeling supported.
I think you're dead right, John. Yeah, and I suppose I was going to ask you, when can you remember the first time you heard about HIV? How did it
80s.
feel? Was it scary? Was it exciting? Or
Well, I think in the 80s, when I remember being really little and seeing the adverts on telly, and they were really dark and gloomy adverts, weren't they? You're gonna die if you have HIV. But I think the reality is, people now live with it, they manage it. I mean, I'm not a specialist, and thank goodness, I haven't got HIV. But I think ultimately, you know much more than I do, I'm seeing people now live long lives with HIV.
Yeah.
I mean, it's come a long way, hasn't it?
it's come on really long way,
But even in programmes, I was watching a programme, I can't remember what it was, but there was a couple and one of the guys had HIV and it was indetectable, and it was just good to see it in mainstream media as well. In the soaps that you would watch or in a series that you would watch, and there's obviously shows the hope for those that might be at the beginning of their journey as well.
That's right, and I think those shows make such a huge difference. Some of us might be old enough to remember Mark Fowler getting it in EastEnders in the 1990s. And then there was someone in Hollyoaks with it, and then of course we had the fantastic It's a Sin series, which came out sort of a few years ago, which told the story of people in kind of the bad old days where people were dying. There was no treatment, there was no cure. And to be fair, there still is no cure, but the treatments have come on such an extraordinarily long way. So, Laura, you mentioned U equals U. We've got what's called U equals U stands for undetectable, means untransmissible. And here in Torbay, 100% of people living with HIV are, if you like, known to the service. And of those, all of them are on treatment, and I think it's like 98.5% of that is effective.
Great.
So it's only maybe 1 or 2 people who are struggling with adherence or effectiveness, but they're still being looked after by our fantastic clinicians and healthcare services. But what that means is that if you've got HIV, you can control viral load to such a level that if you have unprotected sex with another person, you can't transmit HIV.
It's incredible considering
It really is.
what strides it's been made in HIV care.
I mean, it doesn't mean that we should take silly risks, but
No,
I
of
think
course
ultimately, you know, that's a real. I think it must be a relief for the person, because I mean, there's one thing living with it, but if you were to give it to somebody else, you would feel awful. And I think there's guilt around that as well, which is now being managed on top of the actual illness, isn't it? So I mean, it's more than just a sickness, and emotional support there as well, isn't there?
There really is, and I think one of the sort of big features of HIV over the years has been the stigma and shame attached to it, and that comes from all sorts of places, but one of them is, of course, because it's got something to do with sex.
But not always.
Not always, no, definitely not always, but most transmission is sexually most acquisition of HIV is sexual, and that could be because, you know, for example, no condom was used, or because it was split, or because it's unexpected, or through trauma. There's all sorts of reasons why a lot of people who transmit and acquire HIV might not have known they had it.
No, and I think also it reflects to back in the 60s where actually, and the 70s where it was, you know, gay as well, which was also frowned upon. So in my dad's era, it was still illegal to be gay, which is awful. So that's another stigma that's added to it, is, you know, potential drug use, sex, or sexual orientation.
Yeah. So this is where sexual health work becomes fabulous. I love my job. I really, really do, because I get paid to talk about these things all day. And it's not just about disease or the absence of disease. As you just sort of hit upon, we're talking about sexism, racism, homophobia, misogyny, all of these big kind of social justice issues that you think, oh, hang on, that's not really fair, is it? Or why are you treating some people like that? That seems a bit off.
Yeah.
We don't do that. And that's absolutely true to this day. So the stigma and shame that can be attached to HIV, talking about it, testing for it, living with it, telling your healthcare provider that you're living with HIV, telling your new boyfriend or girlfriend, telling your kids, telling your mum and dad. It's really tough stuff. So
it's all anxiety building, isn't it? You know, for those people, although in the real world, people are very understanding, aren't they? But I guess in that moment, your anxiety is building, you don't know quite how to deal with that conversation. And people automatically just feel the worst, wouldn't they? So, you know, if it happened to me, I had to tell my parents, they'd be mortified and concerned, as you can imagine. But the reality is, like you said, if it's managed properly, it can be lived with.
I mean, one way of looking at it is, what if you said, oh, do you know what, I go and see a nurse every 6 months, and they weigh and measure and make sure my blood pressure's okay, and they'd be like, wow, you're doing great.
Yeah, they'd
I
be
want to see,
happy.
so hang on a minute. Some of the people living with HIV are in fantastic health, and they're going to live to a really old age, provided they kind of keep taking care, like so many of us do. You know, the rest of the public health advice still stands. You know, don't smoke, watch your weight. You know, bend your knees, all those kind of good things.
Bend your knees. That's going to help.
This is what I'm starting to struggle with as I get older. Terrible knee. But yeah, there's no reason why HIV is the death sentence that it once was.
Yeah.
The thing that kind of seems to kind of get to people is the poor mental health and the stigma and the shame. So that's why when it comes to National HIV Testing Week, and we see Keir Starmer taking a test, and today our cabinet member, Councillor Hayley Tranter, here in Torbay, she took a test today as well, which I'm absolutely delighted with. I'm really proud of her. She's really kind of taken forward her leadership and sort of demonstrated that. And you know, what we're all trying to say is HIV can affect anybody. It can affect everybody. Yeah. It doesn't discriminate, and actually everybody has a status. You might be HIV positive, you might be HIV negative. When was the last time any of us took a test? So HIV Testing Week says, get yourself a test, claim your status.
It's better to know, isn't it? Absolutely. I mean, you know, if you've got any concerns, go along,
get tested.
So in Torbay, where can they go? Where can people go in Torbay to come and get tested?
Sure. So it's Quite a few places actually. So today the test was done in the community by our commissioned charity organisation, the Eddystone Trust. They've been a Southwest HIV charity for over 30 years, dedicated to supporting people living with HIV, sharing really good quality HIV and sexual health information with all sorts of people. You can find them on the usual media, social media channels and outlets. But they work in partnership with our clinical colleagues at Devon Sexual Health. Devon Sexual Health are, if you like, a part of the Royal Devon University Hospital Trust. And that's a service which runs across the whole of Devon and Torbay. They work very closely with our cousins in Plymouth, which is called, they run a service called SHIP. But essentially what they are is a specialist HIV and sexual and reproductive health service. So yes, they do a lot of that work. Now, of course, you could always go to a GP ask for an HIV test as well. So you can get an HIV test in all sorts of places.
And you can do it at home as well, can't you?
Well, this is the great thing about HIV Testing Week is you could go to the website, which I think is...
I think if you just Google Torbay Sexual Health...
We can put some links in the credits.
Yeah.
We'll do the links in the credits.
Thank you. See, I run aground there. That's great. But this week you can go online and they will send you a free test to your house.
Great.
And they're doing that up and down the country, and they tend to only do it quite as large for a week or so at a time, because every year they're inundated. I know that HIV Prevention England last year, they ran out by Thursday. They had to get extra supplies and
get in
so
there
many
quickly.
people saw the opportunity to do it. But you're absolutely right. You can go to Devon Sexual Health and get an online test there sent to your house, or you can go to Eddystone and they'll do it too.
So if you're doing it at home, what's the process?
Well, do you remember COVID?
Yeah.
Okay, so...
Oh, yes.
Oh, yes. Many of us do.
I'm not sure I heard of that.
Oh, we should do it on a podcast.
Yeah, I must have been in a bunker somewhere.
For a year.
One of the kind of strange but good things that came out of it is people got a bit more comfortable testing themselves for different things at home.
Yeah.
Right, so I don't know about you, but for weeks I was collecting my regular little COVID test. I did think I was going to do some, marvellous art project with it. I didn't.
Seriously. Love that.
So it's a finger prick test. So you just take a tiny droplet of blood from one of your fingers and you pop it into one of those little cassettes, like the ones that we had in COVID. You add a little chaser and a little sort of buffer kind of fluid. And a bit like COVID's test, you have one line or two lines. And one will show a negative test and two will show a reactive test. And that just means, let's do you another test. Let's see if
Contact
HIV
your
is present.
healthcare professional.
100%.
Yeah.
That's the time where you go to Devon Sexual Health and say, hey, I've had a reactive. I'd like you to follow that up, please.
But it doesn't mean, though, if you've got a reactive that you have got HIV. It could be anything that's tripped that over to saying something's not quite right.
That's right, yeah.
So don't panic.
No, gosh, don't panic. Absolutely not. And then, as we were saying earlier, HIV isn't like it was before.
No.
There are treatments, there are groups, there are networks, there are more people alive living with HIV
Well,
than there's ever been.
Before we started recording, you were saying actually quite a lot of people in Torbay are over 50 who have it. And, you always think about sort of HIV as a young person, a vibrant person that's going to go out and be rampaging the streets. But actually, it's a very different world we live in, isn't it?
Wow, we all got old, didn't we, John? I love it.
I think that it was just a statistic that just made me sit up and go, wow, that's not what I was expecting you to say when I came on today.
No, you're absolutely right. So 50% of people, more than 50% of people living with HIV in Torbay are aged over 50.
Gosh.
Some of them are over 65. And, people are marvellously aging. So what that means, though, is, of course, they're going to start going into needing adult social care. They're going to sort of start, having other, their knees are definitely going to go, for example. There might be other comorbidities. There might be diabetes. It could be, I don't know, sort of cancers or diabetes or all sorts of other kind of long-term conditions might start occurring. The HIV, in some cases, will make that a bit worse. But we definitely see more people living with HIV going into social care settings, whether that's residential care or home care or any of the other kind of sort of touch points in the social care system. And they they want a different type of care. They want they want the workforce to be sensitive to their
So
HIV
that's a
needs.
real key takeaway from this. For social care providers listening, start thinking about HIV training and awareness, and how to just be, like say, sensitive to this situation, really. And actually, because a client may present HIV doesn't mean you have to panic.
Yeah, they're not got leprosy. They're not a leper.
No. You don't need to double glove, and you don't need to be putting it all over the notes, and you don't need to be telling your friends or your colleagues. Those days are over.
It's really relevant, really important. That top tip for the day for social care providers: think about this now, because actually it's going to affect us.
It's coming.
In now,
it's here.
Or whatever. Yeah.
So, John was talking about sensitivity, so it'd be really interesting to see if there's any sensitivity training out there for social care providers with regards to patients with HIV. Do you know of any?
Yeah, so I mentioned the Eddystone Trust.
Yeah.
They've been doing some training and have a programme called Hive. You can go to their website, www.eddystone.org.uk.
Yeah.
They have a range of training on offer, and one of their courses is called Thrive. We're trying to put more and more of these training sessions and courses onto the adult social care training hubs. I think there's one called Hive.
Yes.
So we're trying to get things advertised on that. We're trying to send out campaigns to people. So we have World AIDS Day, which is the 1st of December every year worldwide. And that's our opportunity to dust off and rock the red ribbon, which was the original ribbon, the OG. So there's lots of opportunities to kind of talk about HIV. But yeah, I think getting more into the normal training, thinking about how we're caring for people. But it's not just the people we're caring for. It could be your co-worker. It might be you.
Yeah.
I might already have family members that are living with HIV.
They might not even know.
They might not even know.
No.
But would you treat them differently?
I would not.
No.
So no, of course not.
Why would you treat your colleagues and potentially, people that you're caring for differently? It's a lot to think about, isn't it?
I think it's just so much naivety, isn't
Yeah,
there?
definitely.
That's the trouble.
Yeah.
People still, like you say, have this stigma attached to it. And you go, God, it's HIV.
Yeah.
Oh, goodness me.
But if that was you, how would you want to be treated?
Like an idiot, like I am,
Like a normal person, because they are a normal person.
I'm joking.
Stop
No,
that.
absolutely.
Absolutely. It's that same level of respect and integrity that you would treat any of our patients or people that we care for.
So that brings us on to the who and why.
Can I just say though, before we go into who and why, I'm interrupting you because I need to bring us back slightly. We do a lot of work, both do with international recruits.
Yeah.
And sometimes they are very untrusting because they don't understand necessarily the UK and how it works, and they don't know who people are. But they're entitled to come and have these tests as well, aren't they?
Oh, 100%. And get treatment.
And get treatment. So
Yes.
if they're here on a sponsorship, they can come and get tested.
Yes.
And then get treatment while they're in the UK. And I think that's a real poignant bit to take away, isn't it? I mean, and you deal with many, many more people than I do around this.
Mm-hmm.
I think it's a really good selling story to people, isn't it?
And that's confidential information, advice and treatment, and that's confidential support as well for them, for their families, if they're pregnant. That offer is extended to everybody. That's part of our deal for public health, and it's how we keep everybody safe, is by offering HIV treatment, testing and care to everybody living in the UK.
So if it does affect you and you are listening, please reach out, because there are services that are here to help you. No judgment, confidentially.
Yeah. It doesn't matter if you've been here one day or 10 months.
No.
If you're here
5 years.
5 years. Come and get tested.
Yeah.
And get that treatment.
Absolutely. And there's some really good people who really know what they're doing, who will support and care and help you get your viral load back down and kind of be fit well for work.
For those of us who are stupid, what does viral load mean?
Oh, so it's if you like, how many little bits of virus have you got in your body? So if I only had one tiny little bit of HIV in my body, I might find it difficult to pass it on. If I had a lot, it would be a bit easier for me to pass it on. So the aim of the game is to get my viral load, or the number of little bits of HIV in my body, as low as possible.
Super. Thank you for explaining that. So now you can carry on.
No, I'm really interested in viral load now. So when, when people start to take the antivirals or their PrEP, what is it that you're looking to get their viral load? What's an undetectable sort of number?
Oh, that's a really good question. Now, I must profess I'm not a clinician.
Does it vary?
No, there's definitely a clinical threshold, and I might have to quickly look that up.
No, it's fine. I just wondered.
But it's different to PrEP. You mentioned PrEP, which is a fantastic thing. I can talk about that.
Yes, please do.
What's PrEP? Because I've never heard of PrEP.
So PrEP is similar to PEP. So PrEP is pre-exposure prophylaxis. Let me break that down. So before, exposure, the event, prophylaxis, stops you getting it.
Yeah.
So this is a drug that you can take that stops you getting HIV if you're exposed to it. So think of it like this. Think of it like contraception and the pill. If you take the pill before you have sex, you're probably not going to have a pregnancy. If you take PrEP before you have sex, you're probably not going to get HIV.
So it'd be more like if your partner is infected, and that is something that you would do.
Right. Yeah. So if you know that your partner's living with HIV, or that you might be meeting someone at the weekend and they're likely to have HIV and you don't really want to ask for a condom, PrEP is something you could choose to use.
But please do ask for a condom.
Yeah. Please don't just rely on that. So how long before do they have to take it? Or is it something that people just take, like the pill, they just take it regularly?
Well, there's two different ways. You can take it every day, or you can do event-based dosing. So event-based might mean, if you're meeting someone on Saturday night, you might start taking it Wednesday, Thursday, and take it for a few days before. So you can do event-based or day-to-day.
That's a lot of preparation, isn't it?
Be prepared.
Be prepared.
Yeah, I'm popping out on the weekend. I'm going to get laid, so it's Tuesday. Let's crack on.
You don't know. You might be prepared to be prepared.
You don't know what your invites
Don't know
diary
what's
looks like on Saturday night.
I do.
Wow.
Chinese in a film.
And then there's PEP, which is after the event treatment. So something might have happened at your weekend that you were not expecting.
Yeah.
And you might come away and think, I wasn't sure about that person. There might be a risk of HIV. There might be a risk that I've acquired HIV, so you can then go and get PEP. The PEP is quite a bit like PrEP. It's time limited, so you've got to get yourself to Devon Sexual Health, or maybe accident and emergency, pretty swift afterwards. Yeah. So we're talking 24, 48, 72 hours. Sooner the better. Yeah, sooner the better.
I have an acquaintance that did CPR on somebody and they died. There was a lot of blood and they were HIV positive. So that person then had to go to A&E and then have some PEP. Say PrEP. And, blood tests and everything as well. But you have to wait for 6 months to then get so the fact that the PEP is available as well as waiting on that blood test for 6 months, that's...
Wow, so you could be sat there at home with your husband or wife in that situation saying, oh my God, I'm now not quite sure how to engage properly sexually because you're not sure, are you?
Yeah.
That anxiety must be really quite something.
It can have quite an impact, yeah. But again, there are ways to manage to support people to do that. Yeah. So, PEP's quite a thing, and it's definitely used by occupational health. It's the same treatment.
Good.
So one is, if you like, we would call it PEP-C, so SE, so post-exposure prophylaxis after sexual exposure.
Not going to forget that, are we? Pepsi?
No.
Try and say it drunk.
Try and say that drunk.
Well, no, because you would say Pepsi.
Pepsi, yeah. But yeah, so we've got PrEP and PEP. PrEP is a massive game changer.
Yeah.
It helps people really kind of navigate the sexual health world.
Yeah.
What it doesn't do is it doesn't prevent any other STIs. And as with all these things, some sexually transmitted infections go hand in hand. So it's great that people are taking more care to prevent HIV acquisition. But actually, what about all the other things? So again, gonorrhea doesn't discriminate either, nor does syphilis or chlamydia or any of the other things. And age is not a prevention. So just because you're 55 and, perhaps you can't make someone pregnant anymore or you can't get pregnant anymore, doesn't mean those other things aren't present.
And just because people are really attractive doesn't mean they won't either. I mean, they'll be fooled by... Because, there was a great campaign, wasn't there, a long time ago now, of beautiful blonde lady on the side of a bus saying, "I'm HIV positive." I don't know if you remember that. And I just remember looking at it and thinking, it's a real shock. You tend to go, wow, actually, this isn't just for people that are on drugs. This could be anybody at any time, and they might present as the most healthy person in the world.
HIV does not discriminate.
And condoms.
You keep talking about condoms.
Because it's so important, you know, for the other STIs. And I think it's also important to mention that it's not just for genital sex either. Condoms for other kinds as well.
Yeah, absolutely. HIV can be transmitted in a range of ways. STIs can be transmitted in a range of ways. As we used to sort of say, you know, where you have sex is where you get the STI. So yeah, absolutely take care. Condoms are still free. You can get those from Devon Sexual Health. You can get those from the Eddystone Trust. They're very low cost as well. I used to work with young people, and they were sort of found that shame and stigma, and actually they found it easier to go to the pound shop and buy condoms there. Well, you know,
fair enough.
Go where you go.
Yeah. If it keeps you safe, let's not be precious.
And you know, it doesn't just keep you safe. I think it can help you relax into the moment. If you're having a special moment with someone, and all the way through you're thinking, oh, well, what if I get chlamydia, or what if they've got HIV? You're not really going to be on your best game, are you? Best performance. You're not going to be living your best life. You're going to be feeling a bit worried about that. Whereas if you've put a condom on, rock and roll, you might just, you know, feel much.
Suddenly you're a stallion, baby.
Suddenly you're ready to roll again and again all night.
You could ask them to see their latest test or when they were last tested.
That could be an awkward moment.
That would be.
Just before you carry on, where's your list?
Well,
show me
it's
your
your body. You need to protect it. You know.
It is, and there's lots of different ways that we like to help people look after themselves and have fun while they're doing it. Good. No one wants to stop anyone having fun, but also no need to worry or feel that stigma or shame.
But I think we do need to also get back to, like you were saying earlier, there's lots of other ways that people have contracted HIV. I mean, there's a big thing this year, wasn't there, about the blood in the 80s that got transferred. In fact, one of my very close friends, her dad died. He was is it celiac when you bleed? So he had a transfer of blood.
Haemophiliac,
Haemophiliac, sorry. Oh, I don't know, do I?
Celiac is gluten intolerant.
That's the one, yeah. But he contracted HIV and passed away very sadly in the early 90s.
Awful.
So randomly, I haven't seen this lady for about 15 years. I'm sat watching the news and she's up with a banner in London on the news. I'm like,
good for her.
What are you doing there?
Good for her.
But I think
that must have been quite a thing to see her.
Well, you know, I've known this lady for many, many years, and we're best of friends, but I just, you know, when you see somebody like, hang on, rewind that, let me have a look.
Yeah.
But it's really important that people understand there's lots of different ways, isn't there, that you can track this, and the stigma isn't there because there's so many ways. Actually, it's just life, isn't there? People get ill from lots of different things.
It's also no one's business how you got HIV.
Exactly.
So I remember meeting someone with HIV at a conference I went to, and she was recounting how she had a new GP, and the GP said, "So how did you get HIV?" And she just said, "Oh, well, if you don't know, you should Google it."
Oh my God, I love that.
Because it's none of his business, whether it was through unprotected sex, injecting drug use, whether it was through a blood transfusion, whether she, you know, acquired it at birth.
Who knows?
It's none of because what's loaded in that is a judgment about someone's lifestyle or their past or their history. Yeah. It doesn't matter. She needed her GP to help keep her well, healthy,
safe. Do you think
that
primary care and nurses and social care and people are more educated now, though? Because that was a careless question, wasn't it?
I think some people really are very switched on. It depends on how much exposure people have had to it. But one of the things I do know, particularly in Torbay, is that we have quite a lot of late diagnosis. So that means people who have got quite an advanced stage of HIV. They've got quite a high viral load, for example. They might be presenting with things like, I don't know, thrush in the throat and the mouth, or with respiratory kind of illnesses, or all kinds of other symptoms. And the last thing on their GP's mind is HIV. But you don't know what you don't know. So I worked with a lady many, many years ago, and she was a slightly older woman. She was probably in her sort of mid to late 60s. She was a grandmother. She's white. She's heterosexual. living somewhere in South Devon, and she didn't expect to have HIV, but her husband had worked in Africa for years on the oil rigs, and he would come home every 6 months, but he would have shore leave every 3 months. And at shore leave, what happened at shore leave happened in shore leave.
Doesn't
stay
stay
on
shore
shore
leave.
leave.
Didn't necessarily stay in shore
stay
leave.
on shore
He came
leave.
home every 6 months. And so she didn't know that both of them were living with HIV until the consultant picked it up when she was very, very, very unwell. And at no point did her GP ever think, I'm just going to run an HIV test, just to eliminate that as a possibility. So we talk a lot about clinical indicators, and there are a whole host of clinical indicators. You can find these on all sorts of websites. They're very much out there in terms of advice and guidance for primary care staff. But again, there's a message for our adult social care workforce, but there's a message for the primary care workforce as well, which is don't discount this. HIV is definitely in the southwest.
It's a
It's
real
definitely
thing.
in Devon. It's definitely a real thing, and it affects old, young, black, white, straight, gay. It affects all sorts of people in all sorts of ways and all sorts of reasons. I mean, hands up if you know someone that might have once had an affair. Okay, listeners, are you putting your hands up? I'm not saying you, I'm not saying your partner, I'm saying do you know someone that did? Well, that's how HIV can happen. So you might be in the most loving and trusting relationship, and my goodness, I hope I am, and I hope you are too. But sometimes life happens, and sometimes things do. And so this is why we say to people, you know, if you're not sure, just test.
Yeah.
And then you know what your status is. So you might be HIV negative, you might be HIV positive, but there's no shame in knowing what your status is.
No, really important
Yeah.
messaging. So, what do you want to finish on then? Because this has been a really interesting podcast, and I'm really glad we came over.
Yeah, I just wanted to finish on how has it changed? How's the stigma changed? How's the treatment changed?
Well, we've got You Equals You, which is brilliant. HIV is much harder to pass on now. Tends to be people that don't know that they've got HIV that pass on and get HIV, not people that do know.
Yeah.
So if you know your person, your patient, your partner has got HIV, you're in pretty safe hands. If you're not sure, get that test. So that's one thing that's really, really changed, is people used to be a bit fearful of people living with HIV. They're not to be feared. They never were, and they definitely are not now. And don't be scared of anything. Grab the nettle, find out. It's better to know than not know. It's empowering, and it's definitely not a death sentence anymore. There's a lot of hope, a lot of treatment. There's some fantastic new treatments coming down the pipeline as well. We're seeing things like combined contraception and HIV treatment, so you wouldn't even know that someone was on HIV treatment. So the future is bright. We still don't have a cure, no. We still don't have a vaccine, no. But stigma is something that we can do something about right here in Devon, right here in Torbay. And I invite you all to get tested, wear your red ribbon, and don't be afraid to talk about it with your friends, family, loved ones, colleagues, patients, clients.
And I expect there's lots of really good support groups out there, isn't there? But there's some great support groups with lived experience and people that are sort of living with it and helping.
You're definitely not alone. You are definitely not alone. Yeah, there are definitely people here living with HIV, and you'll find lots of people online as well with a huge amount of support, advice and guidance to help people through those initial moments of a new diagnosis.
But I mean, I'm anti-Googling. You know, I think if you're going to take any advice, though, take it from a professional.
Don't go to Dr. Google.
Don't go to Dr. Google or necessarily to a really lovely person on a support group. If you're unsure, ask a professional, I think is the key, isn't it?
But if you do go online, look at the Eddie Stone Trust, look at trusted, NHS kind of pages to get the information, to get the local support that you need. If you do, sometimes some people feel safe online. I look at things online, but look at reputable sources that are trusted.
And don't try and buy the medication online and stuff like
No.
that. I mean,
No.
you see these things all the time, don't you, where people, rather than being embarrassed as a doctor, think, do you know what, I'm just going to try and treat it. And they
Home
buy
remedy.
dodgy sites, and you can buy this, you can buy that. Actually, there's like you say, there's no shame.
No shame.
Go and see a professional. Get
It is
the
a
right help.
complex medical issue, and you do need a consultant to support you through a treatment journey.
Yeah.
It changes as we get older, our bodies change, treatment journeys change.
Yeah.
Adherence is a lifelong commitment. But that's why we're so lucky to have people like Devon Sexual Health, fantastic consultants, clinicians and nurses working there. They really know what they're talking about, and they will never say anything to anybody. Their confidentiality is it's of the highest possible level and sensitivity. They won't tell your GP unless you want to link that care. So when we say it's confidential, we really mean it. So please, I agree. Please go speak to the professionals.
Thank you so much. I've learned so much today.
It's been a fantastic episode. Thank you so
So
much.
lovely to meet you both. You're so lovely. Thank you for the opportunity.
Thank you.